Hey guys, welcome back to the channel. Today we're going to be looking at antibiotics. The classification of antibiotics are usually done according to their spectrum of activity. Depending on the range of bacterial species susceptible to antibiotics, these can be classified as either broad spectrum, narrow spectrum. So broad spectrum antibiotics are active against both gram-positive and gram-negative microorganisms. The examples of these include tetracyclines, phenocols, fluoroquinolones, third generation and fourth generation cephalosporins. The narrow spectrum antibiotics have limited activity and are primarily only useful against particular species of microorganisms. For example, glycopeptides are only effective against gram-positive bacteria. Aminoglycosides and sulfonamides are only effective against aerobic microorganisms. Antibiotics can be further divided into two other categories, and these are known to be either bacteriostatic or bactericidal antibiotics. So what are bacteriostatic antibiotics? As the name suggests, bacteriostatic. They stop the growth or restrict the growth and reproduction of bacteria by interfering with protein production, DNA replication, or other aspects of bacterial cellular metabolism, not necessarily killing them. Examples include leconosamides like clindamycin, lincomycin, macrolides like azithromycin, clarithromycin, erythromycin, sulfonamides, sulfadiazine, trimethoprim, tetracycline like doxycycline or minocycline. The bactericidal antibiotics are, as the name suggests, are antibiotics which kill the bacteria as well as inhibiting their growth and reproduction, interfering with bacterial cellular metabolism. Examples include beta-lactam antibiotics, penicillin derivatives, and cephalosporins. The table below suggests the grouping by mechanism of antibiotics. So cell wall synthesis can be affected by a number of antibiotics such as penicillins, cephalosporins, beta-lactamase inhibitors, and others. Protein synthesis inhibitors include aminoglycosides, tetracyclines, macrolides, chloramphenicol, clindamycin. DNA synthesis inhibitors include fluoroquinolones, metronidazole. RNA synthesis inhibitors include rifampicin. Mycolic acid synthesis inhibitors include isoniazid, and folic acid synthesis inhibitors include sulfonamides and trimethoprim. Some of the things that we must consider when giving antibiotics. So we must be looking at the type of infection. Is it a diffused infection or is it a localized infection? The type of patient, are they healthy or are they medically compromised? Does the patient have any previous history of antibiotic allergies? What type of antibiotic do we require? Do we require an antibiotic which has a narrow spectrum or a broad spectrum? Should we be choosing antibiotics that cause the fewest adverse reactions? We need to be really prescribing antibiotics that are the least toxic. We should consider giving antibiotics which are well established but still effective antibiotics. It's recommended to give bactericidal rather than bacteriostatic antibiotics. Also, cost is a very important factor, so give something which is going to be cheaper but still an effective antibiotic. And you may also consider providing a combination of antibiotics. So for the remaining video, we will be looking at the most common antibiotics that are prescribed within dentistry. So now we're going to be looking at the most common types of antibiotics used in dental care. The first choice of antimicrobial is a penicillin, such as phenoxymethylpenicillin, penicillin V, or amoxicillin. These are effective for dentoalveolar infections. Amoxicillin, as a short course, high dose, has been shown in a randomized controlled trial to be as efficacious as a conventional phenoxymethylpenicillin regimen in the management of dental infections in children. Amoxicillin may be useful for short course or regimens for infections when required. Amoxicillin also has a broader spectrum of activity in comparison to phenoxymethylpenicillin, which, though as effective, is less reliably absorbed and needs to be taken 4 times daily on an empty stomach. However, amoxicillin may encourage emergence of resistant organisms. In line with principles of antimicrobial stewardship, when prescribing antimicrobials to treat an infection that's not life-threatening, A narrow spectrum antibiotic should generally be the first choice of antibiotic. The second choice of antimicrobial is either metronidazole or a macrolide, example clarithromycin, which offers improved pharmacokinetics and toleration compared to erythromycin. Metronidazole can be used as a first-line treatment for patients allergic to penicillin, or as a first line of treatment of patients who have had a recent course of penicillin for another infection. It can also be used as an adjunct to penicillin in severe spreading infections. Metronidazole is also great if a predominantly anaerobic infection is suspected or microbiologically proven. Clarithromycin can be used as a first line of treatment for patients allergic to penicillin, and also as a first line of treatment for patients who have had recent course of penicillin. Other antimicrobials available for dental-alveolar infections include clindamycin, which is very effective against antimicrobial activity against oral anaerobes. In a randomized controlled trial, it has been shown that the clinical results using clindamycin were similar to those with penicillin for treatment of acute dental abscesses. However, there is a high rate of adverse gastrointestinal effects, and diarrhea has been reported in association with clindamycin treatment, with an increased risk of C. difficile infections with clindamycin. Clindamycin is a great antimicrobial of choice due to allergy or drug interaction for some individual patients. Carmoxyclav, which is amoxicillin and clavulanic acid, is active against beta-lactamase producing bacteria and are resistant to amoxicillin. The BNF suggests that it may be used for severe spreading infections with spreading cellulitis, an infection that does not respond to the first line of antimicrobials. A systematic review looked at harms associated with amoxicillin or carmoxyclav in a randomized placebo-controlled trial. Although the harms were poorly reported and the true incidence was likely to have been higher, diarrhea was only reported for carmoxyclav and candidiasis for both amoxicillin and carmoxyclav. Cephalosporins have also been used for oral infections, but they don't offer any particular advantage over penicillin in dental infections and are less active against anaerobes. Well, thank you very much for watching the video. I hope you found it very useful. If you haven't already liked, then please kindly like the video. It really helps the channel to grow. And if you haven't subscribed, then please press the subscribe button now. Thank you very much again, and we'll see you again in the near future. Bye bye.